and whatever you have are a number of different substances, and we'll get to them a little bit later. But here you need to understand the washing, the application of any of your, let's say, antioxidants that sit here in our top of the pyramid. Any of those substances that you want to work during the day will have to be applied underneath if you use a physical sunscreen. Otherwise, you're disturbing the physical sunscreen, you're moving it around, the particulate matter cannot adhere and form that even layer. Very, very different with chemical sunscreen. So we have lots of different sunscreen agents for chemical sunscreen, and the chemical sunscreens work completely differently. Of course, you apply them on top of the skin, right? But what do? They bind underneath here. They bind with the cells, and this is why, in general, we say apply about 20 to 30 minutes before exposure, so that this interaction here can happen, and that there is, in fact, a chemical interaction between the top layers of the epidermis with the sunscreen, so that there is great protection. Now, those chemical sunscreens, if you allow them to have this interaction time, they can't really be wiped away because they have the interaction time. So you can really put things on top. So in other words, if somebody's using a chemical sunscreen and you really want them to have the most benefit of the sunscreen, you need to somehow assure that you use this one first after washing their face, and then you can put layers on top afterwards, and you don't have to wait very long. Now you can do it the other way around. It is possible to put on something first and then the chemical sunscreen. Here, it, so to speak, almost doesn't matter. It can work either way. If you have them use something else before, you need to make sure that you're not doing something to block this person's ability to put the chemical sunscreen on. Let's say, if you were to use something with glycolic acid on top, it penetrates nicely into the epidermis, there's no problem. You can have them then use the sunscreen on top of it, and it will still not be an interference with the binding to the the top layer keratinocytes. If you do have the person apply the glycolic acid on top of that, you want to wait just a little bit until this interaction occurs. Make sense? Makes sense. But here you kind of really have to understand what you're doing and what layer, in what order it has to come. There are some experts in the country who will say we shouldn't really be putting anything underneath. The interaction needs to be the firmest possible. They will state the chemical sunscreen needs to be first in line, and only then you can pack everything on top. But as I said, if you have enough interaction time, you can make this work either way. You just need to be able to explain it to your patients and to your clients that this is sort of something that they need to pay attention to. And just as a reminder, and I know I said that last week, but there are differences in the types of sunscreens, and if you're looking for the utmost protection, for example, when it comes to the protection of skin that has melasma or post-inflammatory hyperpigmentation, it's a really, really good idea to go with the physical sunscreens. And if it's simple protection and they have a good stabilizer, such as the Celox Shield or the Helioplex in the Neutrogena and Aveeno sunscreens, or some other mechanisms that work in that particular regard, it's okay to do chemical sunscreen and have really good protection in this layer here. All sunscreens need to be reapplied. Typically, the reapplication time for sunscreens is mentioned as every 2 hours. Why do we say every 2 hours? Well, because whatever happens in the cell here, in the uppermost keratinocytes, when they have gone into bonding with the sunscreen, they will absorb that ray, that UVB ray that they're capturing, and they're done with their job. They've finished, gone. I've done my job, I now have nothing, I have no capacity anymore. So in other words, there are a number of cells that now are no longer able to do anything more. You don't bounce the rays back like the physical. You absorb right in here and they are disabled. Okay, so you have to reapply because there are enough molecules that are now no longer functional. And that makes it necessary to reapply. Why do you have to reapply these guys? Obviously, they are reflective, right? Why do you have to reapply them? Any thoughts?
I just assumed that they wore off.
Exactly. Through movement, heat, and they're kind of an undoing of the emulsification of the creamy layer or the gel layer that's in between. They wear off and distort, and they create little cracks as if you're in the desert, through which the sun rays can penetrate. So really important to also think why you're doing these things. And this, if you are outdoors, this can happen after an hour with a physical sunscreen. So if you have a melasma patient, I have every single one of my melasma patients reapply their sunscreen every hour when they're outdoors. Really, really very important. Otherwise they think, oh, they're so protected because they bought this 20% zinc oxide cream. And they look all white, but in fact they have little cracks that they didn't realize, right? Okay, so in any event, these are important issues with sun protection, your base layer of your anti-aging pyramid. Any questions about sun protection?
There is never a sunscreen that is both a physical and a chemical?
Yes, IntelliShade, for example, is one of those. There are many combination sunscreens. And with the combination sunscreens, you kind of have to use your best judgment when you educate. So obviously, since it has a little bit of a physical inside, you can never say, oh, just wait a little while and then put your other things on top. Don't say that. Just say, do everything first and then put that layer on top. But make sure that you don't have anything that prevents the physical sunscreen from interfering, like from binding, such as anything that's a grease layer on the skin. That might not work. It might not penetrate through that grease layer. If you have some serum that you feel is a little bit too kind of heavy, not cream-based, but more oil-based, that you might not have great penetration of your chemical sunscreen through that. So really, really important to pay attention to that. And when it comes, for example, to this elastin nectar, I think it has a little bit of an oil base to it. And I feel that maybe it would be better if it was, I'm going to have to investigate that a little bit more, but I think it might be better to have that as your second layer if you're using a chemical-only sunscreen. That's my gut feeling, because it has a little bit of that silicone or dimethicone shear, and you know dimethicone or any silicates work the same way. They kind of create this shield on top of the skin, which also makes the skin really, really smooth feeling, but it's really difficult to make anything penetrate through that. Right? There's not a great penetrating substance, you know, it's a great finishing substance. All right, any questions about that? We lost Dana. Dana, where are you? No, somebody's receiving a phone call. Dana, are you still there? Is it an important phone call? Okay, good. No questions about sunscreen? Anybody?
I have one question.
Yeah.
Somebody has sensitive skin.
Mm-hmm.
Is there, like, would you go with a physical over a chemical, or?
Always. Always. That's the most common thing with people who have rosacea. They generally have issues being able to tolerate any of the benzoates, and so I think it's a good idea to have them predominantly on physical sunscreens.
Okay, yeah.
Okay, good. Any questions about sunscreens now? Sure? All good questions. Okay, we're coming to our second layer, retinoids. What do retinoids do?
Cell turnover.
Cell turnover. Love that. Okay, so I need a, do we have a towel to take the drawing off?